Hey everyone, welcome back to InsightRx. Today we have Sai Kota. She is on the pre-med track with a strong interest in trauma care. She's passionate about holistic healthcare practices and is dedicated to helping patients through long-term care rather than short-term fixes. Sai currently works at sleep care clinic and occasionally assists the provider at an urgent and primary care clinic. Welcome to our podcast.
Hi.
First, we're going to start off by talking a little bit about your high school life. So, what sparked your interest in healthcare back in high school?
Actually, so when I was in high school, I was on the business track and I actually went into college with a business degree. I didn't decide to become a medical professional until after my freshman year in college. So in high school, a lot of my activities included working at Key Club or I was in some of Women's in Science. I don't know if Apex Friendship still does that, but I was in that club and I was in DECA. So those were my main organizations that I was a part of. But the reason I decided to go into healthcare was because my grandfather passed away from COVID and the treatment at the hospitals was not very good. So it gave me a passion to look into that, and that's what made me do that. So my high school medical stuff was not I did not do anything with it in high school.
Were there any teachers, mentors, or experiences in high school that encouraged you to pursue medicine or healthcare?
Not really, just because I was on the business track, so a lot of the teachers that I talked to were like Mr. Jackson, who I know doesn't work at Friendship anymore, but just the DECA advisors more than anything else.
Okay, now kind of like looking back, because you talked about like doing business back in high school. So, is there something you wish you had done differently in high school to help you better prepare for this field if you had known that you were going to go into it?
If I knew that I was trying to go into healthcare when I was in high school, I feel like I would have been a part of HOSA. That's
Mm-hmm.
probably more along the track than DECA would be. I still really appreciate the knowledge that DECA gave me because I feel like knowing that business sense and knowing how to write business plans is very important regardless of whatever career you go into. Other than organizations, I would have had a bigger focus on internships or job shadowing in the healthcare field rather than business, which is what I did. So
Mm-hmm. Now switching gears into college and training, what made you choose your specific college or program for becoming a medical assistant?
becoming a medical assistant, if you're trying to go in the hospital track, you would need a program, but there's a lot of online programs available. However, a lot of the more smaller clinics in the area, they don't really require any what's it called? Certification. So you can ask them and they would most likely say yes if you have any prior experience, which I started off with a nursing assistant certification and I worked at UNC hospitals for a couple years before I started working at a clinic as a medical assistant. Um, in terms of picking a university, I'm not gonna lie, undergrad for healthcare, I feel like you should obviously pay attention to where you're trying to go, but the choice in medical school is going to be more important.
Mm-hmm. Okay. So, how did your coursework and clinical training experience prepare you for the healthcare field?
In college,
Yes.
when you take classes like anatomy and physiology or even biology, that is kind of your gateway into more specific classes in those fields. So once you take Bio 1 and Bio 2, you can go into microbiology, genetics, or whatever path you're interested in. I went down the genetics path because at that time I was very interested in like neurosciences and that type of field. I'm also very interested in psychology. So I feel like all of those types of classes are really useful in healthcare because It encompasses everything, especially classes like psychology and anatomy and physiology, because obviously you need to know anatomy to understand how the human body works. But at the same time, psychology is really useful because, in my opinion, like I said, I like looking at a person as a whole when I'm like treating them.
Mhm,
So for me, the psychological effects of any sort of surgery or hospitalization are very severe. So knowing those like terms and understanding psychology is really helpful in treating patients.
mhm. You're okay. Um, what were some of the biggest challenges you faced in college or training, and how did you overcome them?
Okay. The biggest challenge is a lot of the times if the teacher isn't that good, then it can make it hard to comprehend what you're supposed to learn. And it can make it hard to want to learn. And it'll seem more like a chore than learning. So that's probably a big challenge. That's why Rate My Professor is a really good um tool to use because it can tell you if the professor you're going for is not good or good. In terms of clinical experience, finding a job is really hard, especially in this economy. It takes a lot of emails and a lot of reaching out and a lot of no's before you get your first, yeah, you can shadow or yes, you can intern here or work here. I applied to UNC hospitals like 5 times before they let me in. And it takes time. And that was all within the span of 6 months. They just get so many applications that they just go through them really fast. Even in terms of working at like primary care or urgent care clinics that are more localized, most people have a draft of what they're going to send out and they just fill in the information for that specific clinic and just email a bunch of different places because otherwise it's really really hard to lock them down. So
Mhm. Did you participate in any internship, volunteer work, or shadowing opportunities during college that really helped? If so, what was their like specific impact?
work-wise, like I said, I worked at UNC hospitals. I worked at 2 different places there. First was the inpatient float pool, which I feel like was the best decision I could have made in terms of my first clinical experience because inpatient float pool basically means you're gonna work in the hospital and they're gonna float you to whatever place needs you the most. So I got to go to multiple psych wards. I went to the burn clinic, the ER, pediatrics. I went to where else did I go? I went to the cardiology unit, and it was really nice to see like how each specific unit works, and because they're all different, they're all in the same hospital, but each unit runs itself differently, and obviously the patients you're going to see are completely different, and it gives you a better understanding on patient care and how nurses and doctors interact with each other. That was really good for me. um After that, I worked at Carolina Primary Care and Urgent Care, and that was really good for me because it taught me a lot more procedural stuff. So while working there, I learned how to do X-rays, I learned how to draw blood, give injections, vaccines. I learned smaller procedures like stitching and minor wound care, which was really good for me because the hands-on experience was very useful in actually understanding what you're supposed to be doing. In addition, working there, I was able to shadow the doctor a lot more. So she would make me scribe for her, send out prescriptions, stuff like that. So that was really useful too. Yeah.
Hmm. How did you balance the academic demands of your program with other aspects of your life?
No, that's a fun one. I did not. um, it's really hard, but it's sometimes manageable, but it's really, really easy to overload yourself. Earlier this year, I was taking 21 credits in school, and 36 hours working a week. On top of
Mhm.
that, we had dance practices, and on top of that, like homework, and I had to sleep. So I burnt out very quickly. So it's you live and you learn. You'll find out what your balance is and you should stick to that. I think the hardest part is comparing yourself to other people. Never do that because it might work for some people, it might not for others, you know? So just do what makes sense for you, I guess.
Mhm. Now we're moving into the future. So reflection. So what motivated you to choose the medical assistant path over other healthcare roles?
There are a couple entry level or like roles that are good for getting better, more clinical experience. I know people who've done like EMT. I was a nursing assistant before I was a medical assistant. Personally, I feel like for medical assisting, I picked that because it's more patient focused and I can work in a clinic where I can really see like how patient interaction should go and I get a broader understanding of how like the medical field works. So that's why I chose medical assistant.
Hmm. What does a typical day in your job look like, and what do you enjoy most about it?
So a typical day in my job. I just started working at Sleep Doc Direct, so I will maybe tell you about Carolina Primary Care because I just started there. So, um, when I was working at the urgent care, a typical day would be checking patients in, working at the front desk to check them in if I need to. When they come to the back, which is where we get their vitals and stuff, I would get their vitals. I would ask them their history, make sure they're like what medications they're taking, what ailments they may have had in the past, any family history, drug, smoking, alcohol usage. I would then ask them specifically what they're there for, and then I put them in the room. Based on what they tell me with their history, like if they're sick, I would run a COVID fever strep test. If they were bit by an animal, I would ask about tetanus and other vaccines that they would need for that. And I would ask if the animal was vaccinated. Then I'd bring all of that information to the provider who would then go see the patient. And after that, depending on what they need, I would either help draw their blood, give them certain injections that they might need. If they broke something or sprained something, I'd take their x-rays or I would wrap their arm or leg up depending on what they needed. For things like stitches and stuff, at first I would just bring all of the equipment to the room for the provider to do, and I would watch her do it and give her what she needed. So that's typically I would also send referrals to, because in primary care, you can't fix everything. So you just refer them off to other places for more specific needs. So that's what I would do.
Where do you see yourself in the next 5 to 10 years? Do you plan to continue as a medical assistant or move on to nursing, a physician assistant, or another type of field?
So I'm currently in school, so in the next 5 to 10 years, I would hopefully be done with med school. My plan is to go into trauma care, whether that's like an ER doctor, surgeon, anything like that. To be honest, after medical school, my immediate plan is to go into Doctors Beyond Borders, and go through there and then work at a hospital as either a surgeon or an ER physician. So that's my broader plan.
Mhm. So, what advice would you give to us high school students or college students who are thinking about future in healthcare?
I would say if you're thinking about a future in healthcare, the best thing to do get is to apply to a variety of specialty clinics so you can get a more versatile like experience. Um even if you know what you wanna do, like, I know I wanna go into trauma care, it's really important to see what the other fields have to offer as well. Because 1, you might find another field that clicks better for you, and 2, almost all of the fields do overlap at some point, and it's good to know how everything works. So I guess that would be my biggest advice.
Yay. Okay. On that note, we thank you for letting us have you on our podcast today. We thank you for your time and consideration. Thank you so much.
Yeah, of course.